All right, this is your detailed overview of the Comprehensive Health Assessment assignment, which is due in week 7. This starts on page 19, this detailed piece of it. So, in this assignment, you are conducting a comprehensive health assessment demonstrating your ability to integrate evidence-based practice, technology, leadership, and systems-based thinking while maintaining a professional and ethical standard. So you have two pathways to complete this assignment. Option A, if you are already working in a clinical practice environment, you are going to select a patient from that clinical setting and complete your comprehensive health assessment and then analyze the assessment and process those findings. Please, please, please maintain HIPAA compliance. So that means you are not saying the patient's full name, their, full date of birth. You are maybe, like Xing out the year, or even just saying, like a 76-year-old patient, something like that. You, instead of using their name, you can use their initials. You could say patient X. You could give your patient an alternative name. Just make sure that you are telling me that to maintain privacy. If you are not in the clinical practice setting, you are going to utilize a simulated case study assessment, which is available on the Moodle shell in week 7, and I will show you where that is after we go through this piece out of our syllabus. And you're going to complete your assignment utilizing the scenario that you choose. All right. I will let you review the learning objectives. We're going to move on to page 20. So this is a two-step, two-part assignment. Part 1 is the comprehensive health assessment that is worth 30 points. If you are in option A, you're going to select your patient, maintain that HIPAA compliance, and you're going to complete the comprehensive health assessment, document all your findings. You're going to integrate at least 2 technology tools that you use in your assessment. So was it a mobile health app? Was it an EKG? Was it a telehealth platform? You're going to integrate that. And I will show you where this template is. If you are utilizing an option B, so a simulated case, scenario A is an adult patient with type 2 diabetes and hypertension. Scenario B is an elderly patient with early stage dementia and mobility issues. Please just let me know which patient you are going to be talking about. And then you are going to complete that same template using the required assessment components. You're going to propose an order of the assessment. You're going to kind of tell me what you think you're going to find and maybe some challenges. You are also going to integrate at least 2 technological tools that you would propose to use in the system. So basically, the difference between option A and option B, option A, you're actually doing this on a real life person. Option B, you're kind of giving me a cookbook recipe. This is what I would plan to do. This is how I would do it. All right, that's part 1 of this. Once you do that, we're going to move into part 2, which is the analytical paper, and it is worth 70 points. So you are taking the findings from part 1, and you're going to write a paper and analyze that assessment process and your findings. So just remember, if you're in that option B group, you are going to kind of have to tell me what you would think that you would find. It's not necessarily definitive, but it's what you anticipate finding. Option A, people, you are telling me what you did find and what your true outcomes are. So as we go through this, you are going to see the first few bullet points are going to be for anyone doing option A, and then you can ignore anything that says for option B students. If you're an option B student, ignore the first 4 bullet points in each of these sections and go straight to the for option B students and make sure that you are including that. Big hint right now. As we go through, there are, I think, 6, let's just double check. Yep, 6 numbers. Each of those should be a heading in your paper. When we are talking about APA formatting, those headings should be bolded and centered in your paper. And then the information that correlates with these bullet points that you're going to tell me, that should be all the information underneath of that heading. So you're going to have a title page. On page 1, you're going to have your first line is going to be your title, centered, bolded on the page. Then you're going to give me an introduction. No heading for an introduction. That's just, you go right into a paragraph. After that paragraph, the first heading is going to be this evidence-based practice, and you're going to give me the information that pertains to that, whether you're option A doing this or option B focusing down here. You're going to go down through and do that for 1, for 2, for 3, for 4, for 5, for 6. It's not on here, but at the end of 6, I expect to see a centered, bolded heading labeled conclusion and a nice little conclusion paragraph. Then you're going to go to a new page and you're going to have references titled bulleted, and you're going to give me your reference list. All right. This should be at least 5 pages in length, no more than 10. Give me quality over quantity. All right. If you can give me a really great paper in 6 pages, awesome. All right. That's fine. Please follow APA format 7th edition. You need to have 3 scholarly sources cited in text citations and on your reference list within the last 5 years. You can incorporate them any way you want. If you find a really great article on maybe leadership and collaboration, throw that reference in there in that appropriate section. If you have a really cool piece of technology that you looked up a little bit more information about, throw that in there. Just make sure that you give me at least 3, okay? I need clear professional writing. Make sure you're integrating your course concepts and terminology and maintaining that HIPAA compliance in your patient information. So don't give me full-blown patient identification. Give me initials. Tell me an age. Give me a birth date, 12/17 XXXX. Keep it compliant. You are going to submit both the health assessment documentation, so that's part 1, and the analytical paper. You're including all of your references, and it is due at the end of week 7. So, what I want you to do is the health assessment piece that you're doing in part 1. I want you to include that as an appendix, as you can see here, appendices, in your paper. So, you're going to have your title page, your paper, however long that is, and your reference page. And remember, title and reference pages are not counting in that 5-page minimum. I want 5 pages of actual paper. Then after your references, you're going to do a new page, and that's going to be Appendix A. And you are going to, sorry, I feel like I'm going to sneeze. You're going to copy and paste over that health assessment that you did, and that's going to go in as Appendix A. So you're going to submit one document with both the paper and the assessment piece to it. And it is due at 11:59 at the end of week 7. So how's it going to be graded? Here are your bullet points. Another hint, these all correspond with those numbers 1 through 6. Let's jump down here to page 24. This is the grading rubric table. I live and breathe by a rubric, whether I am the student or the instructor. All right, so that's good news for you. You can write yourself to a paper because this is how I'm going to grade you. So this first row just pertains to that part 1 health assessment. If you want 30 points, I need a full health assessment with thorough documentation, all body systems included, at least 2 technological tools are included in the assessment, whether they were simulated because you're an option B or that's what you actually used as an option A. Okay. The rest of this is in reference to part 2, the analytical paper. Okay. And as I alluded to, each of those numbers is worth 10 points that we talked about, those 1 through 6. So all you need to do, if you want to make sure you get a 10 on evidence-based practice, come over here. I need at least 3 evidence-based practices that are discussed thoroughly and analyzed and applied, and then that you have the appropriate references. That'll get you 10 points. So on and so forth. Okay, that's how each one is going to be. Obviously, as you get less and less points, we're maybe not being as thorough as we need to be, or we don't have the 3 evidence-based pieces that we need, or maybe we didn't put the section in at all, and that's going to get us over here to that 0 to 2 points. There is an added section, if you will, about APA format and grammar style. Okay, we do have to take a look at that. Obviously, the more errors you have, whether grammatical or APA, that is going to affect that point value. So this is how I'm going to grade you. All right. Let me take you over here. We're going to go down to week 7. All of that just came out of your syllabus. All right, here we are on week 7. If you scroll down underneath learning resources, here are comprehensive health assessment for simulated patient A, which I believe was the diabetes and hypertension, and then comprehensive patient B, which was dementia. So there are your two. If you need to have the simulated patients, there are the descriptions. You can just pick which one. Here is the comprehensive health assessment template that you're going to use. Everybody is using that template. So whether you are doing option A with a real patient or option B with one of our simulated patients, everyone is completing this document. You're going to then copy and paste that and put that in as an appendix on that final paper. Then this is where you're going to go to submit that paper. It is due at 11:59 p.m. on Sunday, March 1st. All right. Late policy will be in effect just like it will be for all the other assignments. All right. I think that is everything that you should need to complete this. If you review this, read everything, and are still like, I don't know what I need to do, I'm confused, email me. We'll chat. We'll figure it out. We'll get you on the right track. I am here to help you. I look forward to reading these. Um, this is going to be a cumulative thing from all the assessments that you're going to have done in all the weeks prior. So just keep this assignment in mind if you want to kind of start working on it as you're maybe completing the respiratory assessment earlier in the course, and then you want to kind of come down here and work on that. That's fine. Just remember 11:59 p.m. on March the 1st.